Hi, my name's Sarah, and I'm going to be your student nurse today.
Okay.
Is it okay if I do a postpartum assessment on you?
Yeah.
Okay, let me just hand sanitize real quick. Okay, can you state your name and date of birth for me?
Graceland McKyle, January 7th, 2000.
Perfect. Okay, I'm going to start off by taking your vital signs. Can you open your mouth for your temperature? Okay, I'm going to check your blood pressure. Okay, I'm going to check your pulse and your respirations.
Okay.
Okay. So I'm going to get started off. I'm going to listen to your lungs, and then I'm going to also go down and listen to your abdomen as well.
Okay.
Just take a deep breath for me. Okay, now I'm going to see your abdomen. Okay. How have your breasts been feeling? Are they tender at all?
Yeah, they're a little tender, but not anything out of the ordinary.
Okay, I'm going to go ahead and take a look.
Okay.
Okay, I don't know any redness, maybe a little swollen, but that can just come with the tenderness. I'm going to go ahead and palpate in a circular motion. Okay, and your nipples do look a little dry, like they're chapped. Do they hurt at all?
A little bit.
A little bit, okay. We can talk to the doctor about that, but we might be able to get you some moisturizing cream to put on them. So now I'm going to go ahead and check your uterus just by holding your pubic region area, and I'm going to take my other hand and I'm going to feel around. We're feeling for the fundus, and can you put your hand up here and feel it?
Yeah.
Okay, so about every hour, even after you go home from the hospital, we're going to try and massage that just every hour, just for a couple minutes. Right now yours feels really firm, so that's great. It is midline, about lined up with your umbilicus, which is awesome. So it's good there. Have you passed any gas?
I have passed gas. I haven't had a bowel movement.
No bowel movement? Okay. So constipation is pretty normal with after giving birth. All you can do is like increase your fluids. Once you're able to start walking, or the doctor says, hey, you can be walking by this time, go ahead and start walking. Just take a little walk just to get things moving, and try to increase your fiber intake in your diet.
Okay.
Okay, and that should help a lot. So now I'm going to go ahead and check your pad. When was the last time you voided?
Probably just about an hour ago.
About an hour ago.
Pad.
You changed your pad? Okay, perfect. Did you notice any clots?
No clots.
No clots? Okay. Mm-hmm. And was that blood pretty red, like a bright red?
Yeah.
Yeah, okay. So I'm going to check yours now. I don't notice any clots. The blood is red. No unusual discharge. So that's awesome. If you were to have clots, you definitely need to call your doctor up immediately and go from there. I'm going to go ahead and have you roll over onto your side. And did you have any tearing during your vaginal birth?
Just a little tearing.
Just a little tearing, yeah. Okay. I noticed the stitches, everything looks pretty clean. I don't notice very much swelling, maybe just a tad bit. I don't see any hemorrhoids, which is also great because it's less pain for mama. Yeah, no discharge and everything looks good. Okay. Now, and I know you had an epidural, so we're going to go ahead and check the epidural site.
Okay.
Is it tender at all?
Just a little tender.
A little bit,
yeah.
Okay. It's a little slightly red, like it's just a little irritated, not anything too worried, or to be too worried about. Don't notice any discharge from there. So everything looks good there. You can go ahead and roll back over.
Okay.
Okay, so now I'm going to go ahead and check for DVT in your calves. Do you notice any pain when I'm touching?
No.
No? Okay. I don't notice any redness, which is great. No swelling in the calves, but your feet do look a little swollen, which is pretty normal after giving birth. Best what you can do is go ahead and just try and go on walks when you're able to. That always seems to help quite a bit.
Okay.
Okay, we're gonna put that back down. Okay, and you did not have a cesarean, but if you were to, I would go ahead and check the incision site. If they're, most of the time it's going to be covered. I'm going to check, we're going to leave that coverage on, And if there were to be any drainage on it, we would go ahead and trace the drainage and date it, time, everything like that, initial it. But I don't notice you don't have it, so
Okay.
we're not going to do anything with that. Now I'm going to go ahead and check your IV site. Any pain?
Mm-mm.
No? Okay, don't know any redness. There's no edema, it looks good. Okay, so emotion wise, my patient was great. She was very cheerful the whole time, smiling, looked like she was enjoying herself and her new baby. I think teaching points, I already hit most of them. If you do become constipated, you did say that you haven't had a bowel movement yet, which is totally fine, because we normally look up to 24 to 48 hours after giving birth to have your first bowel movement. Just increase your fiber in your diet. You know, you can take fiber supplements as well. Those also help quite tremendously. Walking is going to be so great. If you do notice any unilateral swelling, so like swelling in one leg and not the other, you're going to want to go ahead and call your doctor.
Okay.
Don't try to flex your ankle or anything too much, because that might cause more problems. So just call your doctor.
And will my bleeding continue to be bright red?
For the next few days it should. Up to about 6 weeks is when it should change completely. It won't be red anymore, bright red anymore. But no, in the next few days to weeks, a couple weeks, it should be bright red discharge. All right, do you have any other questions?
No, thank you.
All right, yep, you're welcome.